Hi, my name's Dr Chris Provan. I'm a GP who works in Aberdeen, and I'm one of the doctors leading on the CONNECT project. CONNECT is about improving communication and joint working amongst doctors across NHS Grampian, across primary and secondary care and within secondary care. Because there's clear evidence that if doctors become engaged and involved in designing services, patient outcomes improve. And there's a huge amount of good work going across NHS Grampian around improving how we work together. It's about taking the best of that and spreading it. CONNECT is about the clinician's voice being heard, and we're having a meeting on the 25th of March, and that's an opportunity for your voice to be heard. The CONNECT programme has already had 136 GPs and consultants shadowing each other, and the feedback from this exercise has been excellent as a way of building relationships, creating understanding and breaking down barriers overall. We've highlighted the issues around recruitment and leadership development. We're improving a programme called Paired Learning to try and help with all these types of things, so we're highlighting issues as we go along. But it's your chance on the 25th of March to come along and have a discussion with your colleagues, your professional colleagues, as to how we take this forward. On the 25th of March we'll be taking clinical cases and actually talking about how we as clinicians communicate across the system, looking at complaints and things that have gone well, and seeing how we can actually build a better system for our patients and continue to highlight problems to the system. But CONNECT isn't really a talking shop. We've already had several projects come out of the first events around ambulatory care, trying to improve orthopaedics, working with our geriatricians. All of these types of things have come from the CONNECT project. We're also keen to highlight opportunities around direct access to investigations. This would be an opportunity for GPs to feel they can improve their investigation and take the pressure off some departments in the hospital. So that's a big theme of what we'll be talking about as well. We've widespread support from GP Sub, LMC, Royal College of GPs, the Royal College of Physicians. Malcolm Wright himself has also voiced his support for ourselves. So the Health Board are listening and trying to take on the views of clinicians, and it's our opportunity to put those views forward in many different formats. It's also an opportunity to meet your consultant and GP colleagues and share what's happening. So I know it's difficult to take time off from frontline clinical care, but I'd really urge you and encourage you to come along in the afternoon of the 25th of March. Be involved in our discussions in general about how we take things forward together. Thank you very much.